Difference between transgender and intersex. Although the phrases transgendered and intersex are sometimes used interchangeably, they really refer to separate biological and gender-related ideas. We shall examine the distinctions between transgender and intersex, as well as their definitions, root causes, and effects in this post. What is transgender? Often, those who identify as transgender or transsexual feel as though they were born into the wrong body, while having standard male or female anatomy. For instance, a transgender or transsexual person may have standard female anatomy but feel more like a man, and they may choose to transition into becoming a man by taking hormones or by having sex reassignment surgery. What is intersex? Individuals with intersex disorders have anatomical differences from standard male or female anatomy. The majority of intersex patients seek medical attention when their parents or physicians recognize something strange about their body. Those who identify as transgender, in contrast, have a unique subjective experience of gender identification. Intersex conditions may appear in numerous ways, such as ambiguous genitalia, mismatched internal and external sex organs, or variations in hormone levels. Apart from not having the normal XX or XY chromosomes, intersex people may also have other chromosomal patterns like XXY, XY, or XO. Intersex conditions are believed to afflict roughly 1 in 2,000 persons. However, the precise prevalence is unclear owing to variances in definitions and classifications. To confirm their physical sex traits to societal norms, intersex people may have medical treatments, such procedures, and hormone therapy. Intersex disorders can have a variety of complicated causes, including genetic, hormonal, and environmental variables. Due to their abnormal sex traits, intersex people may experience stigma and prejudice, which can be harmful to their mental health and general well-being. Although having similarities, the terms transgendered and intersex refer to different facets of gender and biology. The following are some significant distinctions between intersex and transgender. Gender identity versus physical sex characteristics. The term transgender refers to a person's gender identity, which is a psychological and social construct unrelated to one's physical sex preferences. Contrarily, intersex refers to a person's physical sex traits, which could not fit into the usual male or female categories. Voluntary versus involuntary. The phrase transgender describes a person's gender identity, which is a psychological and social construct independent of one's preferences for physical sex. On the other hand, intersex describes a person's physical sex characteristics that do not fall within the typical male or female classifications. Social versus medical interventions. Transgender people may get social and medical interventions to match their physical traits and gender presentation with their gender identification. In order to conform their physical attributes to cultural norms, intersex people may also undergo medical treatment. However, these procedures are frequently carried out without their informed permission and may have a significant impact on their health and general well-being. Prevalence. The prevalence of transgender identification is thought to be 0.6% of the adult population, although the actual number is uncertain owing to underreporting and inconsistent classifications. The frequency of intersex disorders is believed to be 1 in 2,000 persons, while the actual number is uncertain due to different classifications, and despite their similarities, these two organizations cannot and should not be seen as a single entity. In actuality, most individuals with intersex disorders identify as either male or female, rather than transgender or transsexual. As a result, only a tiny percentage of intersex persons encounter issues with their gender identification, in contrast to all transgender and transsexual people. Since they witness two groups of people who would like to select their own gender identification, and occasionally those choices need hormone therapies or surgery, many people mistakenly believe that transgender and transsexual persons have intersex issues.